will need crisis intervention and counseling to deal with the psychological trauma of rape. The nurse will need to show empathy and support to a rape victim. The next question is on sexual assault. The question comes from Test 7, number 83, and reads, a 24-year-old college student is admitted to the emergency room. She is hysterical and states that she was sexually assaulted 20 minutes ago. Which of the following should be the nurse's first priority in this situation? Number 1, remove her clothes carefully so as not to destroy any evidence. Number 2, vaginal exam with lubricant to decrease the pain involved. Number 3, place the client in a private room and leave her alone to grieve. Or number 4, encourage the client to relate what happened and make decisions about the order of examination. The answer is number 4. Encourage the client to relate what happened and make decisions about the order of examination. This was a pretty difficult question. In this scenario, the nurse must prioritize based on her client's needs. Allowing the client to relate what happened will help her cope with the trauma. A good strategy to remember is to allow the client to make some decisions related to her care. Working collaboratively will provide the client with a sense of control. The rape has caused her to feel out of control, and therefore the client should not be left alone. The medical procedures, as stated in choices number 1 and number 2, will need to occur, but are not a priority at this time. The last question and answer for review will look at legal aspects of psychiatric nursing. It is important to remember that clients have a right to the least restrictive alternative, and they can refuse treatment when they are voluntary admissions. The question comes from Test 9, number 15, and states, the doctor has ordered restraints for a very agitated client. When applying restraints to a client, the nurse should include all of the following steps except number 1, use the least restrictive type of restraint that will effectively protect the client from injury. Number 2, fasten restraints to the bed frame. Number 3, tie the restraint with a knot that cannot be undone easily in order to prevent the client from untying it. Number 4, explain to the client and the family the type of restraint and the reason for applying the restraint. Number 3 is correct. Tie the restraint with a knot that cannot be undone easily in order to prevent the client from untying it. Very good choice. The nurse should never tie a knot that cannot be undone easily in case the client needs immediate removal of restraints. The restraints should be fastened to the bed frame where the client cannot reach it. Remember to always use the least restrictive type of restraint that will protect the client from injury. NCLEX RN exam questions will emphasize the importance of providing the least restrictive alternative while maintaining a safe, therapeutic environment for the client. This concludes Tape 2 in the psychiatric series. In summary, I reviewed questions that related to mood disorders, chemical dependence and abuse, organic mental disorders, eating disorders, family violence, rape, and legal aspects of psychiatric nursing. I hope you have identified areas that you may need further study in, as well as the areas that are your strengths. At this time, I would like to wish you success in your chosen career as a professional nurse.